Hello and welcome to our session. Today we are going to look at drug administration, paying more attention to the routes of drug administration, the schedules of drug administration, the dosing regimens, and lastly the 5 rights of drug administration. So let's proceed and look at it, starting with the first mode of drug administration, and that's enteral administration. Enteral administration is the most common form of drug administration, and this is where the drug is administered through the GIT. GIT, remember, it starts from the oral cavity up to the anus, so the drug will be placed along any, but in most cases it's normally given orally, where drug will be swallowed by the mouth. We have several formulations from subforms under it, starting with sublingual administration. This is where the drug will be placed under the tongue, right? And we have drugs like nitroglycerin, the one that will be used to manage myocardial infarction, all right? Next, we have the buccal administration, where the drug can be put between the gums and the lining of the cheeks for this form. Or the rectal administration. Rectal administration, the drug will be put in the rectum. A very good example is the use of diazepam, commonly referred to as Valium, in helping children who are convulsing. This drug is estimated to act within 10 minutes, and the drug will be given rectally. We also have some drugs that are not given orally, and we could be having some reasons. One of the most common drug is insulin. So we have several reasons why insulin may not be administered orally, or why oral mode may not be so conducive for insulin. Number one is because of the digestive breakdown. Insulin is likely to be broken down and then undergo degradation by digestive enzymes in the GIT before it can reach systemic circulation. The other reason is because of its size. Insulin molecules are large, relatively large, so this makes it impossible for us to have enough absorption through the GIT. Also, we have rapid inactivation by stomach acid. This is HCl that is normally produced by the parietal cells. So insulin will be susceptible to the degradation of this acidic environment in the stomach, and it will denature the enzyme molecules and will render them ineffective before they have a chance to exert their therapeutic effects. Furthermore, we also have the fast pass metabolism. So if insulin is if given orally, it not be able to survive survive this stage. Okay, it could bypass the digestion, the absorption, but it has to undergo significant fast pass metabolism in the liver, and this process is likely to reduce its bioavailability and effectiveness. Also, there is risk of hypoglycemia. So, oral administration of insulin can lead to unpredictable absorption patterns and even delayed onset of action. This will increase the risk of either hypoglycemia or hypoglycemia, and this is because of the erratic insulin levels in the blood. So, those are some of the reasons why insulin may not be administered orally. Finally, also we have alternative methods which have come up where we can provide insulin and it can give to maximum yield, like the inhalation, the subcutaneous, and the IV. So that makes oral administration unsuitable for insulin. From oral enteric administration, now we look at the parenteral administration, and this includes any route that will bypass the GIT, the gastrointestinal tract. And the term parenteral, of course, it usually refers to for drugs that are given by injection or infusion. So the drugs will be pumped directly into the circulation. It could be through an injection where we have an IV line, or under the skin. This is what we refer to as the subcute. For example, we use insulin in most cases, the subcute, or into a muscle where we are talking of intramuscular injection. So intramuscular injection, subcute injection, the intravenous, then intradermal, right? So here we have like the BCG, the one that is commonly administered using this technique. For the subcute, we could have like measles vaccines and the drugs here, IV ceftriaxone, among so many others. All right. Next, so we have some of these IM injection sites, starting with the deltoid injection site. All right, the deltoid injection site. To locate it, you have to feel the bone. This is the acromion process. You have to feel the acromion process that is located at top of your arm. So the correct area will be given, will give the injection is you have to at least use 2 fingers with it below the acromion process. Then at the bottom of the 2 fingers, there will be an upside triangle, right? The upside triangle, the one that we can have it like this. And then now you give the injection at the center of that triangle, right? And there is the deltoid region. For this site, you have to give not more than 1 ml of a drug, right? Not more than 1 ml of a drug. The next injection site for IM is the vastus lateralis muscle of the thigh, and this guy, the thigh may be used when the other sites are unavailable. So you have to divide this thigh into 3 equal parts. Okay, you have to divide the first one, the second one, and then the third one, right? So this is the first one, this is the second one, this is the third one. So after dividing, you have to locate the middle one, and then the injections can go into the outer portion of the middle section of this one. The other one is ventrogluteal region, ventrogluteal muscle of the hip. In ventrogluteal region, this is the safest site for adults and children who are older than 7 months. It is deep and close and not close to any major blood vessels. This site is difficult for self-injection, so it's not recommended for self-injection. To identify this mark, you simply place the heel of your hand, right? The heel of your hand on the hip of the patient. And then with your fingers pointing towards the head, so you can see the finger should be pointing towards the head. Then you position your fingers so that your thumb can point towards the groin. And you feel your pelvis with your pinky finger, right? This small finger should be able to feel the pelvis. So you spread your index and your middle finger, and then they should be able to make V, and then that's where you're supposed to give the injection for that case. Next, we have the dorsogluteal. This is the traditional site, and this site is no longer recommended, and it's because there is potential injury to the sciatic nerve, right? So it's no longer recommended. This site is also difficult to do self-injection, so again, you are warned not to use this site for self-injection. You avoid also use of injection site that we have evidence of infection or injury. So when giving injection more than once also, the nurse has to make sure that they have to rotate the injection site to avoid injury or discomfort to the muscles, right? So this is the site for the injection site. We target the gluteus maxima muscles, right? So when giving out the injection, you're supposed to use the Z-track techniques, right? So for the vastus lateralis, you divide the thigh into thirds, and then you use the middle third on the outside or the middle of for the injection. For the ventrogluteal region, which is more recommended, you place the heel of your hand on the patient's hip, specifically the greater trunculata of the bone, then with the thumb pointing towards the abdomen. Then you extend your index and the middle, you extend your index towards the anterior iliac spine, then spread your other fingers back along the iliac crest. Then you do the insert the needle at the V formed by your index and your third finger. So you apply some pressure on the skin as you deliver the injection. For the topical administration, this is where now where you administer drugs via the skin to provide topical therapeutic effects. As all of us know, the skin is one of the largest and most superficial organ in the body, so we have to utilize it to deliver some of this drug. Medication will be applied directly upon on a particular area of the skin or a mucous membrane to achieve a local or a systemic effect. We have drugs like clonidine, nitroglycerin patches. We have drugs from different formulation which can be applied topically around this one. All right. So we have different factors that normally determines the route of administration. Which factor will determine the route of administration? One of the route is depends on the chemical properties of a drug. We are looking at the stability of the drug, the ability of this drug to cross some certain barriers of absorption, like the blood-brain barrier, the placenta blood barrier, or the testis blood barrier. Okay, so if the drug is able to penetrate here or not, that is a key factor. So for oral administration, we need a drug to be able to resist tough acidic conditions like the ones in the stomach, the HCl, right? Then should be readily passed through the walls of the intestines, okay, for the intestine. So that means they must be somehow lipid soluble. Another factor that also determines the route of drug administration is the fast pass effect. All of us know that blood coming from the gastrointestinal tract is directed to the liver, and you're able to see here from the colon, from the small intestine, from the pancreas, from the spleen, from the stomach. All of them will go through the portal vein into the liver. Then from the liver, now it can be collected in the hepatic veins, then to the inferior vena cava, which will be able to take this blood back to the heart. So many medications are broken down or metabolized in the liver before gaining entry into the systemic circulation. So drugs are normally metabolized before they are even reach their target tissues. And this is what we simply refer to as the fast pass effect. Okay, that situations where drugs have to first of all pass through the heart, the liver, so that they can be broken down before they can now be taken back to the heart, where it will now be pumped to the rest of the circulation, right? So medications that are extremely metabolized into inactive forms through the fast pass should not be given orally, because if you give them orally, then they are going to go through the liver, broken down and made ineffective, right? And this is going to decrease their efficacy. Okay? Okay, now for IV administration, for a drug to be given IV, this medication has to be less stable or less capable of being absorbed through the GIT, okay, through the GIT. So drugs like catecholamines, for example, they are normally quickly degraded by the COMT and the MO, okay, the MO, monoamine oxidase enzymes. So giving orally, that will be a waste of time. These drugs are better administered intravenously. So this is also beneficial for drugs that have also a major pass effect. If a drug has a major fast pass effect, it is wise to administer it intravenously than giving it orally, where it will be broken down by the liver and its efficacy will reduce. So when giving medications, you have to calculate, you have to know about the IV drop rate factor. So in IV, we have what we call IV tubing drop factor. This is simply the number of drops it takes for specific tubing to deliver 1 ml of a fluid, right? So we could have a drop factor of 10. That means it will be delivering 10 drops in 1 ml, all right? or a drop factor of 10, that means it's going to deliver 15 drops for every 1 meal. Okay, so 1 meal is equivalent to 15 drops. Okay, so you should be able to at least calculate to see what the numbers will be. Okay, here we have the parts of a giving set. You can also try and review. So bioavailability is another factor of determining the route of drug administration, and bioavailability is actually the practical measure of absorption. What portion of drug has been has been absorbed into the systemic circulation. This is what we are simply referring to as bioavailability. So you take the amount of drug that has reached that circulation over the amount of drug that was administered, multiplied by 100, it should give you the percentage, all right, the bioavailability. For example, when you take 100 milligrams of aspirin orally, right, and only 60 milligrams are absorbed into the circulation, what will be the bioavailability? You take 60, which was able to get to the systemic circulation, you divide it by 100 milligrams, which is the total amount of drug that was given, then you multiply by 100%. You will get that the bioavailability in this case was 60%. In contrast, supposing you gave this drug via IV, what will be the bioavailability? You find that 100% of the drug will reach the circulation. Over 100 drugs that was given times 100, you get that will be 100%. Also, another factor that can determine which route of administration to be used is the urgency of the situation. So drugs that are, you know that drugs that are administered orally, they normally take time to get into the GIT, taken to the liver, then liver taken now to the hepatic veins, to the inferior vena cava before it can be pumped to the heart so that it can pump to the rest of the tissues. So that will be slightly slower, right? It will be a slow method of drug absorption compared to the intravenous, where the drug is directly given into the IV line, right, in the intravenous. So from the intravenous now the drug can go exactly to the heart and pump to the rest of the body parts. So in emergency situation, you find that intravenous administration is preferred over other methods. However, oral preparation are much easier to take at home because they don't need special expertise. So it will be easier when you're discharging a patient. It will make sense when you're giving them oral drugs because that one is easier to be administered at home. So the next thing is dosing regimen. So this determines the frequency of administration and also the dosing interval and the amount of the drug administered for that case being a dose. So the regimen is important since it will affect the onset of action or the time it takes for medication to start working and produce an effect, as well as the duration of action, the length of time during which a medication is going to produce an effect. So we have different dosing regimen. We could have single dose regimen. In a single dose regimen, a single dose of medication will be administered just at once. We also commonly refer to as STAT. So drug concentration will rise smoothly as it is absorbed in blood. Then it will drop again as the medication will be distributed into tissues as it is metabolized and eliminated from the body. We also have once daily dosing, right? The ones that is commonly referred to as OD, right? So this medication is taken once a day. So typically at the same time each day, just to maintain some consistent drug levels in the body. Okay, so we could have such drugs like azithromycin, right? Okay, then you have twice daily dosing, which is given 12-hour interval between the dosage, so it is given twice a day, referred to as BD. We could also have TID, where it is taken 3 times a day. Typically, this is just 8-hour intervals between the dosages. or QID, which is usually 6-hour intervals between the dosages, right? We could also have intermittent loading dose, PRN. This is a drug that is given on need basis. Then have now the continuation phase where the drug is infused intravenously at a constant rate. So here the plasma concentration progressively rises and reaches a peak, but instead of falling off, it continues at a plateau steady state. This is just because the concentration of the medication increases. So does also the rate of elimination until eventually the dosing and elimination are equally. Another key factor is half-life, and this one normally determines the steady state of a drug. This is the time needed for the plasma concentration of a drug to have reached a half, right? To have reached a half its maximum concentration. Usually it takes around 4 to 5 halves to reach a steady state. So on the other hand, the concentration of the medication at the steady state will depend on the infusion rate. So if you increase or decrease the infusion rate, it will also result into increase or decrease in the plasma concentration until it reaches a new steady state. The dose required to maintain a steady state is what we refer to as the maintenance dose, right? So the maintenance dose rate can be calculated by simply multiplying the target plasma concentration measured in milligrams per liter by the clearance measured by liters per hour. So the clearance rate refers to the volume of plasma that is cleared of medication per unit area. The next we have intermittent dosing, and this means that there's a certain dose of a medication is administered at regular time intervals through a given route. If the next dose is administered before the previous dose has been completely eliminated, the plasma concentration will once again progressively rise. So, though the drug levels will be fluctuating between peaks and troughs because the rate of elimination will increase just to match the rate of administration. And like the steady state, it's usually reached in 4 to 5 half-lives. Concentration depends on the dosing interval, and most drugs have a dosing interval approximately 1 half-life. Intermittent dosing, you find that the maintenance dose is calculated by multiplying the dose rate by the dosing interval. So medications that are not administered intravenously, the dosing rate needs to be divided by the bioavailability just to account for the portion of drug that will not be absorbed into the circulation. In life-threatening situations or medications with long half-life, we find that the steady state here can be reached more quickly by administering an initial loading dose. So the loading dose is simply a large dose that will be given at the beginning of a treatment course to rapidly reach the peak plasma concentration, and the loading dose is largely determined by the volume of distribution of a drug, which is used to represent how extensively a medication is distributed throughout the body. Therefore, medications with small volume of distribution will remain mainly in plasma, whereas meds with large volume of distribution will be distributed more extensively throughout the body. So that takes us to the rights of drug administration. And here you have to know that the nurse should focus on the 5 elements of when administering the drugs. These elements include the right medication, right client, right medication, right dose, right route, and right time. Following this or adhering to these rights of medication has proven to be so valuable in reducing medication errors. So in looking at the right patient, you have to check the patients against the client's name against 2 identifiers or verifiers. It could be the name and date of birth for that case. So you have to ask the patient their name, their date of birth. You verify the name against medication administration records and even the client's wristband if applicable. You also need to follow alert procedures when the clients have similar last names, like you can place them in different rooms. Also, number two is looking at the right medication. So you have to know the normal dosage for commonly administered medication where you are working, and you have to check a resource about the medication when you are not sure, right? So when you are not sure, you have always to confirm from the pharmacist or the healthcare provider so that you are fully aware of the drug. You also need to verify the medication against the primary healthcare provider's prescription. So a prescription should have a client's name, date and time the prescription was written, also name of the medication, the dosage of the medication, route of administration, frequency of administration, the situation, like when as needed medication they should be administered, when the parameter for that or when which parameter should be considered before you withhold the drug or when to administer it. And then lastly, the prescribing physician has to sign it, right? The third one is the right dose. So ensure that the prescribed dose is appropriate for the client. You have to use pediatric calculation formula for infants and children. Calculate the dose carefully and also double check all the math calculation. Remember also to ensure that it's the right route. So you give the drug via the prescribed route. Ensure that the route is safe for the client. If a client is vomiting, you don't need to give oral or drugs orally. Okay. If the client is having GI bleeding, right? Yes, you always encourage IV medication. Also, ensure that you're giving the drug at the right time. Give the medication at the prescribed time, ensuring that is less than 60 or after, right? So you can only give earlier or delay by 1 hour, okay? By 1 hour only, okay? Ensure that the medication is administered at the prescribed frequency. It could be once daily, it could be the OD, the BD, the TID, or QID. Also, we also need to also ensure that you're giving the right education about the drug, you're carrying out the right assessment, also you honor the patient's right to refuse medication and you find out the reason why the patient has done so. Okay? Okay guys, that wraps the end of our presentation on the rights of drug administration.